that are available to people upon demand. The city of Calgary, a very conservative province, actually has a health center where people can go. It's supervised, where people have healthcare professionals that can then take them to other services if they require immediately for not only detox but long-term treatment. And so this is what we need to have here in the city of Winnipeg. Now, if the province doesn't want to work with us on this issue, we still have the right to go it alone under federal rules and regulations. So we want to ensure that there's adequate treatment, that there is a supervised consumption site within the city that offers a multitude of options to people and education, and make sure that they eventually as well, that there is prescribed forms of medication that they can obtain that will actually alleviate the use of illegal drugs. And we're not saying to the police that you're not going to be going after drug dealers. What we want to do is provide people who have addiction issues, serious addiction issues, the opportunity to obtain something which is much safer and which is prescribed by medical professionals. And then finally, the long-term issue is also providing those long-term supports, making sure that people can succeed when they're out in the community for the long term.
Yes. During this election, I made a vow that I would really want to work with the tech sector. Within the tech sector, there is a technology called smart contracting, or blockchain technology. I believe that the city could use the blockchain technology to create a supply chain management system that would get the city to procure safe drug resources to the specific health organizations within the province and within the region.
What are you talking about, like alternatives to illegal substances, or?
Correct. Alternatives to illegal substances.
Okay. In the meantime, would you support a safe consumption site?
Yes, I would.
This is where relationship with the province of Manitoba is so important. Addiction and the need for detox and long-term treatment and recovery is primarily a health matter, and of course health is under the jurisdiction ultimately of the province of Manitoba. As mayor, I would work in partnership. I would be concerned with taking on too much of the provincial responsibility, because we just don't have the resources, nor do we have the revenue streams. We don't have the jurisdiction, nor do we have the revenue streams available to us to fund that kind of work. But the partnerships with the province of Manitoba, so health services and addiction services, but also, as I said a moment ago, the third-party agencies, whether it's AFM or Bruce Oak Recovery, Teen Challenge, several of the Indigenous communities that have long-term treatment facilities. These partnerships between the city and the province are really, really critical to address the addiction crisis that is in our community right now.
Follow-up though is, and I'm sorry, I did go to Mars there for a minute, so if
Yeah.
you said this, I apologize.
No.
So it's kind of a quick answer, safe consumption site, yes or no?
I'm open to it, but the province has to be there leading it.
Okay.
Because it is ultimately healthcare. So, and I, for me, supervised consumption sites need to be co-located with other services as well. And I would be really looking for the province to lead that discussion and commit to the work of that important work.
And that would include, say, drug testing to make sure that what people are going to consume is safe?
Well, again, because it's under the, to me, if there's going to be a supervised consumption site and the province leads that, then I should never assume, right? But you would hope that the drugs people are taking are safe to consume. Does this province, I believe the city would have a role to play, but not the lead role, because it's ultimately healthcare.
We'll start with a mobile safe injection site immediately. A part of having a safe injection site, which is a very important part, other than the social lifting of people who are in those scenarios, making sure that we have the supports ready for them, right? And that trust being built with them and having it in proximity to where people are consuming their drugs right now. These are all very important components of a safe injection site that will work. But another part of that is the drug testing. That is the costly part, right? It's the drug testing, is making sure people are consuming non-contaminated drugs. It's not just, and I think that there's always this misconception, well, they're only happening downtown. Well, no, I've met some mothers and family members across the city where you've had 16, 17-year-olds going out, partying for one day and basically not coming back because contaminated drugs. Now, where does the police come into this? That's where they come into this. Their job is actually getting those drugs off the street. Their job is not to show up for wellness checks and everything else. We want them to do their job, and we as a community will do our job. When we take care of people, everything else will lift itself up. Businesses will thrive, the community will thrive, downtown vibrancy will thrive, everything will come, but that's the crux of the issue. We can, on the one hand, talk about public safety. Well, I don't want, I don't want people, breaking into my cars or whatever, issue of the day there is when it comes to crime. And at the same time, from a public safety perspective, not even acknowledge that dealing with addiction with compassion and dignity through a safe consumption site is probably the most valuable thing we can do. Because we have to understand that mixture of fentanyl and meth and all of these things, it's not just smoking pot. We're not talking about just a little bit of an issue. We're talking about a complete change in somebody's chemical balance. It is completely, they don't have a clue what is going on around them. And how do we have individuals consumed with those issues on the street with hatchets and knives and then complain about it on the one hand, send police to take care of it on the other hand, but then not be willing to take the one step that we need to take, that is an evidence-based approach. We know that people have done it, and frankly, safe consumption sites, had they been funded a long time ago, or the ones that are kind of secretly working right now, we probably wouldn't be this far into the disaster that we're in right now.
Well, I mean, there's a number of things, like when some of the drug trade gets into neighborhoods in the form of drug houses, it's really problematic. But I think, again, you have to trust neighborhoods. What Sal Burrows is doing in Point Douglas right now with Powerline, not everyone's a fan, but I've talked to enough people in that neighborhood, and when I walk around, who feel darn fine about it, and they're very happy about it. I've heard other people say it just pushes crime to another neighborhood. That's not my experience. When I go across the street to the people in William White, Darrell Warren and other folks over there, they would like to have that. They don't feel like it's being pushed, but you have to disrupt the drug trade. I mean, my bicycle was stolen. Rick Shawn, the two mayoral candidates had their bicycle stolen. I guess there's a high probability, since that's the currency for meth. The point that eyes on the street is fundamental, but that when you're dealing with people, police are a very politically charged issue today, but if you're dealing with violent crime, you need police officers there. You need people who, when someone's pulling a gun or a weapon, that's not the job for the local public health nurse. It is the job of the police officer. So how the neighborhood works to manage their relationship with the police and police interventions in that, how you trust the judiciousness of a neighborhood, have some fairness to ensure that we're not singling people out. Those are all complex things, but what I saw with Spence neighborhood, what I saw in Point Douglas with these types of programs like Powerline, I think they're really effective, but you also have to have the housing programs. You also have to, it's got to be the underpinning of all the things that make a neighborhood healthy and livable that have to be part of that. Otherwise, you're not going to have any sustainable thing, and the neighborhood's not going to be a place you want to be if that's just a new way of policing. But I'm convinced now, from what I've seen, and more importantly, the people who live in Point Douglas are convinced that Powerline is a good way to go. And it also is the proof of the importance of citizen participation, eyes on streets, and made in neighborhood solutions. That would not work in everyone. Like, each neighborhood has its own culture, its own identity, and needs its own solutions. Absolutely, yes. And how you do them. I'll just say one thing. We had them in Toronto. They were introduced there. I had in my constituency, obviously, some concern. And the way that I helped manage it when people called me saying they didn't want a safe consumption site in their area, we would go on a walk together, and I would walk around and I would show them all the unsafe consumption sites in their neighborhood, and all of a sudden a safe consumption site started looking really good. And even when the government changed and they closed some of these, the neighborhood wanted them back.
Yes, I will commit to reducing the arms of a toxic supply and overdose epidemic as well. One thing is the reason why I'm doing this because I understand about all this overdose stuff. We need to work with our non-profit organizations. I've been to some of those organizations and I know that they've already started helping out on this. The only thing they need is support. From my own perspective, we have the resources. We just have to make use of the resources for the benefit of all. And we have to support them with funding. So even some, they have the talks unit and some other stuff. I've seen a lot and I'm like, wow. So my own philosophy is to collaborate, work with people that have already started working in that direction and make sure that we solve all these problems together, issues together.
Safe injection site, yes or no? Safe consumption site, with drug testing and supports. Are you for it?
I support a supervised one. I support it, but it has to be supervised, right? And we have to provide some services for them that will support them as well. So yeah, supervised one, I agree.
Backlash 4 was looking at the creation of a supervised consumption site, and even today actually is taking quite a bit of backlash on. And I gotta be totally honest, like, a couple of years ago, I would not have been favoring this in my own policy announcement. And the reason why is because I just wasn't educated enough on it. And I wouldn't say I'm 100% educated on this whole topic right now. And I rely on the people who are experts and working in these fields. But the reason why I brought that up was because, I was educated by, I had a meeting with the folks at 9 Circles and, a few other organizations, talking to folks at Main Street Project, I was on the board of Central Neighborhoods, and they had, while they were there on Isabel, they had a program for harm reduction strategy as well. And through that, I started to learn that it's really important to meet people where they're at right now. And, I can't fully understand where they're at. So, and I was shown this by some of my time volunteering at Main Street Project too, is just to, to recognize that people are at different places and people are struggling with different things, mental health, addictions, and who am I to judge? And we just need to do what we can to help them now, and potentially help them on a road to recovery and whatever that looks like to them as well. And so that's why, I started looking at some of the other cities that were doing this, and there are definitely some challenges with having these supervised consumption sites in the area. However, there has been a lot of documented benefits where they can reduce overdose. They're reducing hospital stays. They're testing drugs that are can be tainted and those kinds of things. So, and then at the same time, some of these sites are actually done in with nurses and with healthcare professionals who are there to provide support, to provide maybe some resources that may help that person in whatever they need.
Yes. Well, I mean, we need safe consumption sites. We have consumption sites now that are unsafe. So changing the conversation between consumption sites or no consumption sites, which is a false kind of, it's not what the question is. It's, do we want unsafe consumption sites or safe consumption sites? So that's certain part of it. But, and this is what's exciting about some of these tools that I'm talking about, is because people say, oh, well, those are provincial responsibilities. And I would say, have you seen the police budget lately? And here's a stat for you. The City of Winnipeg Police transferred 2,112 people experiencing mental health crisis to City of Winnipeg hospitals last year. These are human beings. And many of them, it's not a one-time episode. It happens over and over and over again. So we're already in the mental health service business. We've just chosen an intervention that's about as expensive and least effective as you could imagine. And what these tools I'm describing are allowing for the very first time the preventative impacts of love and compassion and medications and land-based interventions, all these amazing things, and compare that against these existing systems. And guess what? The love and compassion is not just better, it's cheaper on an order of magnitude. But these comparisons aren't allowed to be made now because we say, oh, the mental health and addictions treatment, those are provincial responsibilities. We already have a budget for mental health and addictions treatment. And we've chosen the most expensive, least effective interventions we could dream up if we started all over again.
Well, thank you for that. And there's no doubt that, addictions are a real scourge on our society right now. And I'm sad to know that it's a problem that is continuing to grow. It's a problem that we identified in 2018 as well. And there are, again, no end of really great ideas, right? And no end of some really complicated and central planning style ideas. Bottom line is that, I do believe in harm reduction strategies that work. I don't believe in normalizing the behavior. And that is the line that we need to balance, right? We need to strike a balance there. It's not okay for people to think that we condone illegal activities, that we condone addictive drugs, that we condone those things. But at the same time, we need to be more effective in the way that we protect the individuals who are currently victims of addiction, hopefully without having that pipeline keep going, right? So there's two steps to it, right? We need to address the crisis for the individuals that are there. I met with some women recently who were parents had lost their children over the last couple of years to addictions, and they are champions for finding the solutions. And the conversation that I had with them was, what they told me is that there is no silver bullet to it, and I agree with that. There is no silver bullet to it, but the more that we take the strain off of our resources in other places, our first responder resources and things like that, through the elimination of the derelict housing and things of that nature, the more opportunities we're going to have to find good solutions. And I don't know what they are. I'm not going to propose that I know the answers. I don't think anybody does, but I know that what we have to do.
Quick answer then, for or against a safe consumption site?
No.